I would say there's never been a public health crisis of this nature in our recent memories. You have to go back to really the Spanish flu of 1918.
102 years later, Dr. Bob Lutz finds himself on the front lines in the fight against COVID-19.
I'm not someone who likes to be in the public eye. I really like to be behind the scenes, um, affecting change. But I also know as a health officer, there's an expectation of me. People look to me to be that voice of science, that voice of reason, the voice of understanding what's going on.
Several times a week, Dr. Lutz gives updates on the coronavirus cases in Spokane County. He's been the public face for critical information that could save lives.
Well, it's no question that it's stressful. Early on, very stressful, many, many sleepless nights. I mean, decisions that I make, knowing how they impact individuals, knowing how they impact the entire community, that's a very weighty place to find yourself in. It's also a role that I willingly accepted.
Lutz's path to public health started with 4 years in the military. He then did his residency in Florida before moving to Oregon, then to Arizona for his master's in public health. For the last 16 years, he's called Spokane home, and in 2017 was named the county's health officer. 3 years later, he is the face behind the county's effort to contain the virus.
I think the thing that has impressed me the most about this pandemic is the fact that, well, a couple of things. We've learned so much so quickly, and yet there's so much more that we need to learn.
He oversees more than 250 staff members at the health district. Like public health workers all across the globe, they have quickly found themselves consumed with testing, contact tracing, and urging people to quarantine who test positive for COVID-19.
I have people who are in the trenches on a daily basis, who are behind the scenes, who are really doing the hard work, who are doing the case investigations, the contact tracing.
Lutz says he gets through the stressful times reading poetry and running. His job is to look at the facts, the data, the science. But he knows beyond the numbers, these times have been difficult.
I thank everyone for really taking on the effort and the challenges and the stressors of addressing something that nobody has ever seen in our lifetimes.
He gets it. The unknown is frustrating. Lutz encourages the community to stay patient and care for each other.
The reality is that this is not behind us. This is very much with us, and this is very much in front of us.